Well, hi there. Good afternoon. Thanks for joining us again for today's Daily Update. I'm joined again today by Scott McLaughlin, the Chief Executive of the Western New South Wales Local Health District. Just to start with today, worth noting that some local government areas will be looking at possibly coming out of stay-at-home orders by tomorrow. So there will be a meeting this afternoon to consider some of those scenarios. I can tell you that Parkes and Forbes and the Bogan Shire will be looked at. There's no guarantees around that, and lots of things we know can happen in the space of 12 to 24 hours. But those are certainly three local government areas that will be looked at today, and more on that from the Deputy Premier either later this afternoon or tomorrow morning. On that, the numbers today are including a case in the Warrumbungle Shire. Now, Warrumbungle Shire is obviously out of stay-at-home orders at the moment. That case is regarded as being extremely low risk, so we're not expecting any change to that for the Warrumbungle Shire Council. But again, that will be looked at this afternoon in more detail. Great news today, which you may already be aware of, that the 80% mark has been reached across New South Wales for first doses of vaccine, which is really positive news for New South Wales, and up to 47.5% for second doses now. So well on track for all the targets that have been set as an entire state, and that's some really positive news today. Some more positive news today is that up until 8 o'clock last night, we had 6 new cases of COVID-19 across the health district. Now, the reason I'm saying that's positive is that's the first time since August 11 that we've had single digits in our reporting. Bathurst has 3 of those cases, Dubbo has 2 of those cases, and as I mentioned, the Warrumbungle local government area has 1 case. The health district total now, cumulative total, 997 cases, Dubbo up to 720. The Far West, 10 cases, Wilcannia and Broken Hill have 5 each. 362 people are now being looked after in the COVID care in the community program, so that's still going really well. An extra 36 have been discharged in the past 24 hours, so no longer infectious, no longer requiring care in that way. And that's now over 550 people that have been discharged from that program. From the 6 new cases we know that 2 have been infectious in the community, 2 have been isolating, 2 are being investigated still. And Scott will talk a bit more about the other links and any sewage detection worth mentioning today. Now, I mentioned yesterday a new exemption that I thought was worth mentioning again today for libraries, which can now operate as click and collect. So talk to your local council. Libraries will have that opportunity from now, essentially. That exemption was signed as of yesterday, so talk to your local council, and councils will be looking at how to make that work across different parts of the region. Testing in the last 24 hours around that 2,500 mark again. That test and isolate payment I mentioned yesterday, $320 available right now across the region, encouraging you to come forward, test early and isolate if you've got any symptoms, isolate if you've got any concerns, and it's really about targeting those that may have been falling through the cracks and don't have any access to any sick leave or pandemic leave of any kind. Now, just to clarify, I did receive a question yesterday around other payments. If you are directed by health to be isolating or quarantining for 14 days, just to clarify that there is a pandemic lump sum payment that is available. So if you're directed by health, you can apply for that. Again, it's only applicable if you're not receiving any other kind of benefit, including possibly being covered by sick leave. All of that detail is a part of this Facebook post and has been for the past month now, basically. On the post itself is a link to lots and lots of different information, including where to go if you need help. And that help can include things like mental health support, but also financial support for individuals and for businesses. So apart from just watching the video, if you click on the main part of the Facebook post where it says see more, that will open up the entire post, and all of the other information that we talk about regularly is there with many, many links to help you get services that you might need. So really encouraging you to do that today if you could. Testing clinics remain open across the region, and of course that new heavy vehicle testing site at Dubbo, Blackbutt Road Rest Area, going really well. It's open 24 hours essentially. It's staffed there with nurses between 6 and 9, 7 days a week, and then telehealth at other times. So there's always testing available there, and that's making a big difference for our heavy vehicle users. And look, and vaccination, really important. It's such a great day for New South Wales to know we've reached 80% across the state first dose. Second doses continue at the Dubbo Regional Theatre and Convention Centre today. 5 more days of second dosing happening. And just a reminder, please do everything you can to make the appointment you've been given there for your second dose. If you haven't received a text message and you know you got your shot on a certain day and roughly a certain time, please turn up on that corresponding day. So if you got your first dose 3 weeks ago on a Wednesday, today's the day you should be lining up at the Dubbo Regional Theatre and Convention Centre to get your second dose. Make sure you've got your Medicare card, a couple of forms of ID, and if you don't have Medicare, your individual health identifier number, and we really want you to turn up there. Same goes for all of the other ADF pop-up clinics, which will now be circulating around the region. So Park started yesterday, second dose is running again today and tomorrow, so turn up there with all of that detail. We've got a link again on this post to all of the other areas that are coming up in the next week or so, but I can tell you that Warren starts tomorrow with second doses, Peak Hill on Friday, and then Trangie and Forbes both open on Saturday. So click on the link on this post if you need more details. We'll keep updating you each day as well, but do be aware you should be receiving a text message with that information, and turning up at the time is really, really important. Wellington Vax Clinic still going really well. Second dose is happening there as of Monday as well. And just a reminder, the Mudgee Vax Clinic is running a special weekend this coming weekend. So it's all about getting children, school-aged children, 12 years and up, into that Vax Clinic. It's to make sure that children across the Mid-Western regional area are double dosed by the time that October face-to-face date is reached. So if you're keen to be involved in that, children over 12, bookings available at the Mudgee Vax Clinic. That number is 6362 4031, or you can call the South Mudgee Surgery for more details. That's a very special clinic running this weekend, and a great chance to make sure you get your children done. And look, around that idea of booking a vaccination, there are still so many opportunities. I've had lots of GP clinics reaching out, which is fantastic. You don't necessarily have to be a client at a GP to be receiving one of the vaccinations at a GP. They're opening their books far more broadly, far more widely, and encouraging you to be part of it. There's several different ways, either calling them. There's hot docs available for some bookings. Some have special apps that are running now, but most of them are available for people that aren't necessarily clients. That is a really, really good way of getting a vaccine if you haven't yet had one. And in some cases, for those groups aged over 12, it's a really good way of getting your children done as well. Don't forget all of the other ways, including your local pharmacist, who maybe gives you a regular yearly flu shot. So with that, I'll hand over to Scott for his health update.
Thanks, Dougal, and good afternoon, everybody. Well, another day of improving numbers. A decrease again on yesterday and previous days' case numbers down to 6. It's our first day in single digits for well over a month, and so some reason to be encouraged, but I'd definitely say not out of the woods yet. We know that COVID can be circulating in any of our communities any day of the week. We know that there's people being infectious in our communities in recent days, and so I guess it's a real cause for some encouragement, but definitely not a relaxation. We're still caring for over 360 patients in our community care in the community program. So specialist clinicians going into home with people with active COVID cases needing care every day of the week. 15 cases in hospital, and a couple of those are still on ventilators and still pretty crook. We know that the vast majority of people that end up in hospital are unvaccinated, and so again, a real need for us to focus on getting vaccinated right across Western New South Wales. As Dougal said, there's some encouragement with 80% across the state and the vast majority of our region at 80% first dose. We've still got a long way to go, though, to get 2 doses in every arm in the region right across Western New South Wales. So for me, that's the time to double down. While there's, I'd call it a bit of a lull in COVID cases in Western New South Wales, it's certainly not a case for us to relax. Across the whole of our region, we've been doing a lot of work to make sure we've got the ability to care for patients in hospitals, in places, importantly across Western New South Wales. And we've doing a lot of preparation around hospitals like Parkes and Cobar, where we know that we have a fantastic hospital, fantastic staff, and the ability to care for COVID patients if and when we need that. Now, those are all preparations across the whole of the health system we'll continue to do. It's definitely not a time for us to relax and have any of a backseat in our approach to caring for patients with COVID. So to the numbers, as I said, 6 cases to 8 p.m. yesterday. In the overnight numbers, we have seen more cases, and so I would expect in future days there will be increases and ups and downs in those cases. A couple of them I'll talk about in a second of real concern. So to the cases to 8 p.m, 3 cases in Bathurst. We don't know the source for any of those cases, and so there's a real area of concern there. 2 cases in Dubbo and 1 in the Warren-Bungle Shire. That one in the Warren-Bungle Shire we know was not infectious in the community, and so not regarded as a risk to the community. Out of those 6 cases, we do have links for 3. As I said, the 3 in Bathurst we don't have links for. 2 of them are household contacts, and one is linked to a known cluster or other cases. 2 out of the 6 definitely were infectious in the community. So again, another real cause for concern. Those locations of concern are continually being updated. The assumption we all need to have is on any day of the week, any street, any time of the day could be someone infectious in our communities. We have seen a traveller that's come through the region in the last 24 hours as well that has had a couple of locations in Mudgee that will be flagged in the coming days that I really want people to have a look for. Again, a growing number of people that are being cared for over the age of 70, with 47 people aged over the other 70 with COVID in our community across the region. In the aged care facilities, 17 cases in total at St Mary's Villa. No new cases to 8 p.m. yesterday. We have identified 2 additional cases overnight. That will continue to grow in coming days. I expect there's a lot of things being put in place, a lot of additional staff and staff returning to work that are providing fantastic care, I know, for all of those residents and being helped by the level of vaccination in that aged care facility. 17 cases in total in Holy Spirit, no new cases identified overnight, but again, a lot of attention to the care of those residents. More venues of concern that have been identified, so if I can ask everyone to have a look at these, where people have been infectious in these venues, where we haven't been able to contact everyone. So across Bathurst, Walgett and Dubbo, please, for those communities, have a look at the New South Wales Health website. The venues are being updated on a regular basis. They're the most crucial things that we can do to help get in front of the spread of COVID. If you've been in those locations, please go and get tested and follow the advice around whether you're a close or casual contact. Again, a couple of sewage tests have been identified in places where we don't have cases, and these have come up a number of times now. So it's not just a chance of someone travelling through the location. So both in Trangie and in Lightning Ridge, significant risk that there is someone in the community with COVID that is walking around the community undiagnosed and potentially infectious to others. So please can I ask everyone in Lightning Ridge and Trangie, please come forward and get a test. If you've got any symptoms, however mild, if you're concerned that you've been in contact with someone or in a venue of concern, then please come and get tested as a matter of urgency. At Lightning Ridge there is the drive-through clinic, and Trangie, please ring ahead to the local hospital and multi-purpose service. Our mobile testing continues to be available across Dubbo, Orange and Bathurst. Please, if you have transport difficulties, you can't leave your home for a range of reasons, then please ring ahead to our 1300 066 055 number. We know that across both Dubbo, Orange and Bathurst there's been people infectious in the communities in the last week and 10 days, and so please don't hesitate reaching out if you do need support to get tested. As I said, 15 patients in hospital. 4 of those in intensive care and 2 of those ventilated and pretty crook again. Unvaccinated people get really crook into hospitals quite quickly. 362 patients in our Care in the Community program. That number's decreasing every day of the week with the decreasing case numbers, but again, another 36 discharged in the last 24 hours. Can I really take my hat off to our care in the community clinicians? They're a specialist team of clinicians going into homes of people with COVID every day of the week, providing care, support and nourishment and everything else that I know people in isolation and being cared for with COVID are needing at the moment. Again, 15 health workers in isolation, that number's decreasing a lot further. Now, the accommodation support, we've now got 20 motorhomes in Burke being activated and available for people to come and stay in if they're either COVID cases or close contacts and needing accommodation. We've got 10 more motorhomes that will be on their way to Walgett in coming days. Walgett really is an area of concern for us. We've got some surveillance testing happening at the moment. Around 80 tests were undertaken yesterday. I'd really love to see that much higher. We know that the risk of transmission in Walgett has been significant in the last week. Just I might hand back to Dougal there, and happy to come back and take questions.
Thanks, Scott. Anyone got any questions for me today?
If you do, could you just raise your little digital hand, please?
Happy days. I'll dance off.
Thanks very much, Dougal. We'll bring Scott back. Let's kick off with Tom Barber from Daily Liberal.
Yep. Hi, Scott. Is there any, time frame of when the region will reach probably that 70% double dose?
Tom, at the current rate, I'd expect it in the next 4 to 5 weeks. Now, we've had some success in the Australian Defence Force have now extended their time in the region right through to the end of October. So that's a perfect window of time for us as a region, with both the number of GPs vaccinating, the pharmacies, and the pharmacies that will come online in the next week to 10 days with Moderna. There's some exciting opportunities with a new vaccine, very high quality and safe vaccine coming into pharmacies in the next week. The respiratory clinics, the vaccination hubs, and the ADF resources. There's a lot of vaccine now available, so there's no excuses for anyone in the region to not come forward and get vaccinated. I'm really cautious at the moment around people needing their second dose, being able to book in and make sure that that happens. It's the most crucial thing that we can take a step on. We know that second dose rates in some of our communities are still below 40 and 45%. So there's still a long way to go to get to 70 and 80% of people double dosed in our region. ADF resources are just one opportunity out of that, so can I encourage everyone today, if you've had your first dose, make sure you've got plans for your second dose. If it was through the ADF clinics, then those text messages will be coming out to notify you when to come back to the ADF clinics. Now, what we are seeing, though, is a significant number of people not turning up in Dubbo to the second dose ADF clinics. Now, most of those people are from outside of Dubbo, whether it's from Gilgandra, Narromine, Wellington or other locations, where they came in for their first dose, but not coming back for their second dose and assuming that they'll be able to get that locally. Now, that's probably not a bad plan, but what we really need is for people to notify us that you're not coming in. Those are wasted times of very precious people from the ADF, our clinicians, and potentially wasting vaccine. At the end of the day, we don't want to be throwing out any vaccine, and so can I encourage everyone, please take those steps, book in for your second dose and make sure that you've got a plan for that.
Thanks, Tom. Is that all?
Yeah, just a second one. It's the first time we've had, in over a month, we've had COVID cases in the region in single digits. I guess you mentioned you're expecting an increase over the next coming days, but that must be a pretty pleasing thing to see.
Yeah, it is pleasing, Tom. It sort of feels like the eye of a storm. Yeah, we don't want to get too complacent about this. We know that this can come back to bite us very quickly with what we've seen, some of the super spreader events and issues where people have been out in the community, sometimes unknowingly, spreading COVID. And so, it's pleasing to some degree. We know that the rates of vaccination across the region and the risk of people getting really crook is still very high. And so, for me, that the things that have kept us safe and helped us to get to this point are so crucial to maintain.
Thanks, Tom. Let's move to Ollie from Win.
Hey Scott, apologies if my line's a bit dodgy or if there's a lot of background noise in the
You're
car.
right, Ollie.
I just had a quick question about the Bureau of Health statistics that came out yesterday afternoon. A lot of our hospitals, even though they're still performing kind of above average in terms of wait times and response times for emergency departments in comparison to the rest of the state, it's pretty clear that there's been an increase in presentations to emergency departments and people in need of acute care. What's your response to those statistics? And what kind of reassurance can you give that, our hospital systems are going to be able to cope with this ongoing pandemic?
So we've got a great hospital system right across the region. You're right, through the 3 months just gone, we did see some record numbers of patients needing to come to hospital for the emergency services or for other acute hospitalisations. And so that was a part of the risk in our region of the rates of chronic illness and other illnesses where people have needed to come to hospital in really crook state. We also saw a lot of people coming to hospital that probably didn't need to be in an emergency department in particular, that could have found alternatives to the emergency department, either through the local GPs, pharmacies and other ways that they could access some care and support. But what I do know is our clinicians are absolutely dedicated to make sure that every patient gets good care and that's as timely as possible. We know that throughout this pandemic we've needed to focus particularly on making sure that our hospitals are available for both all the patients we need to see every day of the week, but also for COVID patients. And so we've been doing a lot of work to make sure that all of our hospital network right across the region is ready for that. I mentioned earlier the Parks and COBAR facilities. Those are being prepared at the moment if we do need to care for patients with COVID down the track. And so we've done a lot of work. Our clinicians are ready, and we know that in the vast majority of cases we provide good care for patients right across the region.
Thanks so much for that. And just one other really quick question: with the numbers that we've seen today, do you think we've seen a peak in our outbreak in our region?
Well, we've definitely seen some pleasing decreases in recent days and weeks from the highs of seeing over 50 cases a day being diagnosed. Now, a lot of those were, as we know, people in homes that were going to be infected because there was someone infectious in the home. What I'm really concerned about at the moment is the number of people still in the community that are infectious in the community. So if I can urge everyone, please take all the steps that we've known are really crucial. Make sure when you leave your house you're wearing a mask. Socially distance when you go out. Check into a facility with QR codes, and make sure that you're still using the hand wash and hand hygiene products available. They're the things that will keep us safe. I don't want us to see rising cases in coming days and weeks again. There's a real risk that we relax, and that will happen. We know that the way that COVID got into our community was one person travelling in and being in our community infectious for a number of days. And whammo, we've got 20, 30, 40 cases a day within a week and 10 days. And so that can turn around very quickly. It's certainly not a time to be complacent at all.
Thanks so much.
Thanks, Ollie. Riley from Central Western Daily.
Hey there. So just on the low numbers, sort of again, obviously low numbers, even with the low testing numbers, that is a big decrease than what we might be used to. I guess, is it possible, or do you think that maybe the high dose of the first vaccine that's been around the Central West and Western New South Wales could be a reason for these low numbers of cases?
So I think what we are seeing is a fewer number of people getting really crook from COVID-19 because of vaccines. We know that the first dose of vaccine is around 60 to 70% effective in stopping people getting really crook. But it does take the second dose and a period of around 2 to 3 weeks beyond that second dose for it to have full effect. So this is some of the things that we really need to be aware of. Is it's not the immediate time when you get the dose in the arm that you're magically protected. It takes some time to take effect. So there's no doubt we're seeing some of the impact of the earlier rates of vaccination, and particularly in the elderly and frail people in the community. It's been pleasing to see we haven't had a lot of impact across that community, I'd say, yet. A lot of the cases we saw in the early phase of this were young children and people under the age of 20 and 30. And so we know that people in that age group both weren't vaccinated and don't get seriously sick as much as the older generation. So it's a time for some cautious optimism, and any day of the week I think we could see it take off again.
Yeah, right. And just the other one, I was just wondering if any stats were available just on the vaccination rates of other hospital workers here in Orange, or even the health district as a whole.
Yeah, sure. We've got over 90% of our staff have now been vaccinated, and importantly in all of our aged care environments in our multi-purpose services. All of our staff are vaccinated that are caring for residents. We're just following up on a couple of people at the moment. So there's been a significant focus on making sure that, in particularly where we're caring for frail elderly, our staff are vaccinated, and that's the non-negotiable for us. We've got another couple of weeks to make sure that all of our staff right across the whole of the region have got at least one dose in their arm, and through to the end of October with 2 doses. And so with only about 10% of our staff to go, I'm confident we'll hit that.
Thanks for that.
Thanks, Riley. Renee from the Forbes Advocate, do you have anything today?
Hi, I just wondered if you could talk us through what you're doing at Parks Hospital in a little bit more detail, what you're preparing for and what that involves.
Yeah, sure. So both Parks and Cobar, we're preparing parts of the hospital that we know are well suited for caring for patients with COVID. We've had to do a lot of work, obviously, on air conditioning and other safety measures to make sure that we can care for patients safely with all of the PPE and the protections, both for those patients, our staff, and other patients in the hospital. We're confident we can do that in particularly Parks and Cobar. Now, those are steps that we've taken, as you know, with both with Narromine, Dubbo, Orange, Bathurst, and we'll need to take with other hospitals. Now, we work all of our hospitals as a network. We know that patients from outside of some of those locations might need to be cared for in those hospitals. And that's the role that all of our hospitals play on any day of the week. And so it's nothing new. I know patients are used to needing admission to hospital, maybe sometimes outside of their own town. It's certainly the case. We know that Parks plays a really crucial role across that Parks, Forbes, Condobolin and surrounding communities. And so they're all of the protections and supports that we'll put in place for patients in those localities.
And does that include ICU capacity as well? I'm just not sure about what Parks' capacity is.
So we've got intensive care capacity for patients with COVID in Dubbo, Orange and Bathurst. Those are the places we know we've got all of the skilled clinicians, the right supports, the ventilators and everything else when people get really, really crook and they need those support services. In hospitals like Parks, Narromine and Cobar, those are the hospitals where we'll care for patients that don't need ventilation or intensive care support, but they might need, it could be 24, 48 hours of hospital care, some extra oxygen, some support for their respiratory or their lungs and their heart. And so those are the things that we know that the vast majority of patients that have come into hospital haven't needed to stay in hospital for a long time, but they also haven't needed intensive care support. I think today we've only got 4 patients in intensive care and 2 of those are on ventilators out of our total 15 patients. And so those are the roles that some of our smaller rural facilities will play.
Thanks so much. Thank you.
Thanks, Renee. Joanna from ABC Central West. You there, Joanna?
Yes, sorry, I was just having some major headphone issues. Sorry about that. Apologies. First question, Mr. McLaughlin. So ABC 7:30 reported last night that the Central West is leading Australia in terms of regions for the uptake of first doses of vaccinations. What do you think of that? And are you aware of where we are sitting nationally?
Yeah, sure. We are leading the way. The Central West and Arana far west parts of the region have had the biggest increase in first dose rates both across the state and I think across the whole of the country. So there's a fantastic outcome there from all of the vaccinating that's been happening across the region. Really take my hat off to everyone that's been vaccinated in the last week and 10 days. I know the Orange and Bathurst communities that came out in big numbers, over 8,000 people vaccinated in the last week in those centres. Now we've still got some way to go with second doses, so that's the real priority and focus. Making sure that people have got a plan for their second dose. Don't let it slip. If you need to put it in your diary, make a reminder, put it on the fridge, or do whatever you need to make sure that those things are front of mind. The second dose is the most crucial thing to keep people protected, particularly from getting really crook, and to stop spreading and stop picking up COVID.
I see from the figures vaccination rates within our Aboriginal population are still quite low compared to non-Indigenous people. What's going to happen when the non-Indigenous community or the general population hits 80% or 70 to 80%, and yet the Indigenous populations are further down? Are we going to wait until they catch up to open up or to relax restrictions?
Well, what we've seen is a narrowing of the gap, a significant increase of the number of people, Aboriginal people, that have been vaccinated in the last week and fortnight compared to non-Aboriginal people. So much higher increases in both first dose and second dose rates for Aboriginal people. So that's pleasing. We know that there's still a gap and a decreased or a smaller number of Aboriginal people that still need vaccinating. So I'd love to see the next couple of weeks. This is our absolute focus on some of the most vulnerable members in our community. So if I can ask everyone to please think about your mum, your dad, auntie, your uncle, cousins, and particularly Aboriginal community and other vulnerable people in our community that either can't get out for a vaccine, that need help, or may not have thought about it, either because they're not connected to some of the social media and other pieces of information. If everyone can take that role of thinking about the people in their community, in their family and network that still need vaccination, the second doses are going to be crucial for us. So I'm quite confident that across the region we will get there, but we can't leave anyone behind in this.
Thank you.
Thanks, Joanna. Sam from the Western Advocate.
Yeah, hey Scott. Yeah, it's good to see that Dubbo's gone back down and it's now in single digits again, but obviously it's kind of on parity with Bathurst now, but bear in mind Dubbo were recording 30 plus cases a day just 2 weeks ago. Are there similar concerns for Bathurst considering its equivalent population at Dubbo?
I'd say definitely yes, Sam. We know that there's been people infectious in the community in the last week and 10 days. The last 3 cases that were identified just yesterday, we haven't got known links for those cases. And so I'd say for everyone in Bathurst, it's time to be on high guard. Please, if you've got any signs and symptoms, however mild, please come forward and get tested. It's not a time to be complacent. I know the stay-at-home orders, not being able to get out is tiring, but it's certainly not a time to be relaxed in Bathurst.
Lovely. And is the unknown source problem with new COVID cases a common concern with the Western New South Wales Local Health District's contact tracing team?
It's something we see right across the state and the country, that in the first 24 hours it's always hard to identify exactly where the person picked up COVID from. A lot of that contact tracing will continue for days to make sure we can track that down wherever possible. There's still 10 to 15% of cases throughout the whole of this outbreak, throughout our nearly 1,000 people now, that we haven't been able to identify where they picked it up from, and sometimes that's just not possible. But in the case of Bathurst, we'll continue to do that chasing down. Please, if I can ask everyone to look out for those locations of concern. They have been updated overnight. There'll be more updates as we find out more information and try and track down where those people picked up COVID from. But the real reality is that they've been out in the community infectious for potentially up to 2, 3, 4 days. And so everyone should be on high guard because of that.
Thanks very much. And just another one really quickly. Just on the basis of the last vaccination rate figures that the district released yesterday, I noticed, Orange is a good 10% ahead of Bathurst regarding first dosage rates, regardless of the fact that we both had the ADF clinic here. So is that statistic interesting?
I think Bathurst had better play catch up. Absolutely. It's time that when we've got our towns neighbouring with vastly different vaccination rates, we know that Orange was very quick to start vaccinating with some of the GPs and pharmacies and others in the town. We know that there's a lot of opportunity in Bathurst right now. Please don't hesitate to come and look for a vaccination today. If you haven't had your first dose, today's the day. If you've had your first dose and you haven't got your second dose booked in, book in your second dose and make sure you take those steps to get that sorted quite quickly.
Thanks, Scott. That's all.
Thanks, Sam. Oliver from the Canberra Times.
Thanks so much. Just had a quick clarification. You said earlier that the case in the Warrumbungle LGA is being considered low risk and wasn't infectious in the community. So what I was wondering is what actually needs to be discussed this afternoon to determine whether or not the LGA needs to, whether the stay-at-home orders will need to be reinstated or not?
Oh, I think we're still figuring out how we deal with the new cases that get identified and really rapid decision making around the impact of any stay-at-home orders. I know that that's been flagged up and will be taken into consideration this afternoon around what impact there is for the Warrumbungle Shire.
Thanks so much.
Thanks, Oliver. Glenn from SBS.
Nothing, thanks, Matt. Joanna's done my work for me.
Thanks, Glenn. Andrew from Magic 87.6.
Yeah, thanks, guys. Scott, I know that you did say that there's going to be venues of concern for Mudgee being issued later. Do we have any preliminary information on whether this traveller that came through our region just did a short stay, or was it more of an overnight?
Basso, as I understand it, was an overnight stay. We're still tracking down a lot of that information. They came from outside of our region and stopped in another region to the south of us, and so that contact tracing is still underway. It's, I guess, the reality on any day of the week. People can be travelling through our towns. Certainly the case for Mudgee at the moment. So we'll publish that information as soon as it's available, mate.
Yeah, because the community in our area are kind of heightened a little bit, obviously, with a recent addition of 6 cases that kind of travelled here from, we believe, from Sydney, and the number hasn't been officially added to today's figures. Is this the case that's connected with the one that was released with Burrumbidgee, Wagga and Young that is now actually located in Victoria?
So I don't know the details of that. I just know that the person stopped in Mudgee for a period of time, and we've definitely got some risk of exposure in Mudgee. So we'll update information as soon as we've got that available, mate.
Yeah, not a problem. Thanks, Scott.
Thanks very much. And finally, Isabel Everett from Triple M. Do you have anything today?
Hi, sorry, no, I'm all good, thank you. I don't think I have my hand up.
Perfect. Thanks, Isabel. That is everyone. So we will call it a day there. Thank you very much, guys, for attending. I'll get the recordings out as soon as we can.
Thanks, everyone. Cheers.
Appreciate it.
Thank you.